Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Here, the last time he gave a talk on steam vapor therapy cures for prostates, right? It was a really good talk, but I think now it's out of date. I think something even newer and better is coming up. So, guys, whoever here has ever had a DRE? You know what a DRE is? Digital rectal exam, okay. Put your hand up, come on, not up somebody else, but put your own hand, just up in the air, right? So I've only had one, okay? Just one. So the first one is a very strange experience. The doctor said, lie on your side, take your pants off, lie on your side. So, and then here comes the finger, and I'm going, and then he starts saying, feeling something back there, and he kept saying, don't get an erection, don't get an erection, don't get an erection. And I said, I'm not going to get an erection. And he said, I wasn't talking to you. And what I find really odd about that joke is I've got another joke that also ends, I wasn't talking to you, but anyway, I told that, last time he was here, I told that joke to Dr. Niti, the urologist, and he'd never heard that joke before, which I thought was extraordinary from a urologist. Anyway, I better pull my finger out and get on with it and present him. Dr. Niti is a really I've heard him give a number of talks, he's extremely articulate. The clients who've gone to him cannot speak highly enough of him. Herman's a German. Where are you? Herman? Where is Herman? Herman's a German. You went to him recently and you couldn't give him more. He is the best. Somebody else, like the last talk, said, this guy saved my life. So you don't get sort of praise like that. So big round of applause for Dr. Niti with this new breakthrough for treating prostate issues.
สวัสดีครับ Thank you very much. Thank you very much. Good morning, ladies and gentlemen. Thank you very much for having me today. Today I very excited to be here. Yeah, a lot of the people in the room, okay. But I try to speak loudly and slowly, okay. Then today I would like to present about the new technology. It's about the prostate. We call it Urolift. But before I talk about the prostate treatment, first of all, I would like to talk about the mental health issue. The mental health issue that we have to talk about the low testosterone hormone. In the term we call the late onset hypogonadism. The next one we have to talk about the erectile dysfunctions that can affect your sex life, your sexual performance. Another one, the last one, we have to talk about the prostate problem. Anyway, as we know that for the low testosterone hormone level, when we was young, the hormone level is 100%. But by the year, the testosterone hormone is declining 1 to 2% every year. When you take a look on after 50 years old, you know that your testosterone hormone is reducing by a half. How it affect about your life? If you have the low testosterone level, it should be affect about it decrease your libido. Also, you have the erection problem. Anyway, it can make you have the less energy, less endurance to do any activity that you want. In some cases, maybe we call your bone density is going down. We call the osteopenia or osteoporosis. That can affect by the hormone also. Or in your home, maybe sometimes you have the mood instability. Sometimes you get angry. Sometimes you like a crazy guy. It's because of the low testosterone hormone level also. Then if we found that you have that, maybe we have to replace the hormone for you. We have many forms to replace. We have the pills, we have the gel or any injections. But in my practice, I never give my patients the pills because sometimes the pill can metabolism through the liver and can make you have the inflammation into the liver. Then normally I prescribe the gel and the injections that it can improve your testosterone hormone level, that it can get back your quality of life. The one that we have to talk is about the erectile dysfunctions. As we know that if you're over 50, 60 years old, some of our case may be more than 50%, maybe 1 out of 2 in the room have the erectile dysfunctions. How we treat that? The erectile dysfunction we have to treat by the medications, by the pills. We call the PD5 inhibitor like a Viagra, Cialis, or Levitra that can affect, but right now I think it should be affect about 40 or 50% of the case. We have to talk about the hormone replacement therapy that I talked in the last slide. And we have the device. Device is mean that we can use the vacuum device or we can use the low intensity shock wave. Did you know about that? The shock wave is mean that it's like your shock wave on your muscles. That's the same shock wave machine. The shock wave is can improve your blood flow into the penis by increase the small blood vessel in the penis. I think it's worked around 60 to 70% of the case who have the mild erectile dysfunctions. The one that we can use, we call the intravenous injections. We inject the medicine direct into the penis. It's on the demand. Okay, that is work very well. I think maybe 70 to 80% of the case is work very well, and it should be last long, maybe 1 hour for that treatment. But it's just a symptom relief for you in the case who not respond with the pills, or even you have the side effect with the pills that you take before. The another one is the new hope, is we call the stem cell treatment. The stem cell is mean you use the original cell direct into the penis. That is can become to the tissue in the penis for you. But anyway, it's still on the investigation, on the research. It's not used the worldwide usage yet. And the last option, that is the last resort of the erectile dysfunction. If you not respond with the pills, not respond with the injections, that we call the penile implantations. That is the last option for the erectile dysfunction treatment. Anyway, the erectile dysfunctions and the benign prostatic hyperplasia is the enlargement of the prostate. It's a common disease in the aging male. We found that if you're over 60 years old, you can get the enlargement prostate or have the urination symptoms more than 50%. And if you're more than 60 years old, you get the ED maybe more than 50% also. Because the both of them is the most common in the men who over 50 to 60 years old. In the United States, we found that the most common reason that the patients visit the urology center is the BPH. It means the benign prostatic hyperplasia. Then today I would like to talk about the benign prostatic hyperplasia the most. Okay, this is the prevalence of the BPH. We found that if you more than 50 years old, maybe you're gonna have the urination problem maybe more than 50%. 60 years old, 60%. 70 years old, 70%. If you more than 80 years old, more than 80% of the men have the urination problem. And you'll be curious what is the prostate gland. All of them, I know that all of them you know that already. What is the prostate? Let me tell you one more time. The prostate gland is a gland only in the men. It's hiding in the pelvis area. It's around the urethra, we call the water channel, and below the bladder area. What is the function of the prostate gland? The prostate gland is to produce the prostatic fluid that can make the sperm alive. When you get older, the prostate is like a cell is more proliferation, it's more grow up. That make you have the problem. This is the case who have the prostate gland. You will know that this is a prostate tissue. It get bigger. It can obstruct or blocking the water channel for you. Sometimes the prostate can push up into the bladder. It's not only the main function of the prostate, but the main function, the bladder. Your bladder will be changed after you have the blocking of the prostate. your bladder is working very hard. Sometimes your muscle in the bladder is more thickness, and the function is not good in the future if you don't treat the prostate gland. This is a symptom of the prostate enlargement. You can have the weak urine stream. You can get the frequency of the urinations, or maybe after the urination you have the post-war dripping, some drop coming out after you finish. Anyway, some of the case maybe have the urgency. It means rush to the toilet. You cannot hold anymore, or you're gonna leak if you hold the urine. In the some of the case, maybe you have the urine leakage all the time. We call the overflow incontinence. It means your bladder is no space anymore, and it have the high pressure. Then the urine is come out from the penis because it have to relieve the pressure in the prostate. And in the some case, maybe you have to wake up many times in the night for the urinations. That all of them is the symptoms of the BPH or benign prostatic hyperplasia. Anyway, as we know that the benign prostatic hyperplasia, we have the many treatment options. The first treatment option is the behavioral modifications. It means you have to drink less coffee, tea, or even the alcohol. Or you have to drink less water after 6 p.m. As we found that 69% of the case, we do behavioral modifications. Only 29% of the case, we try the medication first. And only 2% have to do the surgery. As we know that 3/4 of the men who take the medication would like to stop the medication after 1 year. The medication that we have to talk, we have the two medications have to talk about. The first one we call the alpha blocker. The second one is the 5-alpha reductase inhibitor. The alpha blocker, this is the first line of the medicine. We giving you for relieve your symptoms. It helps to relax the prostate muscles. But anyway, if you have the good response with that, it can improve the flow for you. It can improve your quality of life. You have to take lifelong. But that medication, they have the side effect. They make you have the dizzy, or make you have the, we call the, when you change your position from sit down to stand up, the blood pressure go to the brain is not enough. Maybe you will be like a dizzy, cannot control. We call the orthostatic hypotension. That is can affect by the medications. In the some of the case, it have effect about the ejaculation also. When you have the sex, you have the sperm come out. With the medication, it go back inside. We call the retrograde ejaculations. It should be the side effect of the medicine. Anyway, for the another option is a 5-alpha reductase inhibitor. This is the medicine to shrink the prostate. It can shrink maybe 20% after 6 months times. Anyway, if you good response, you have to take lifelong. And they have the side effect, most side effect that they have, decrease your libido, decrease your erections. I found that maybe 30% of my case who get that medicine, the erection was not good. Okay, this is two common medications for the prostate. Anyway, what I would like to talk about, that we call the term we call the bladder outlet obstruction. That I explained to you before. When you have the prostate blocking in the water channel, right? The bladder is work very hard. Sometimes it's change. The bladder mucosa is the muscle is work very hard. That can muscle have more thickness. Sometimes you can get the permanent damage on the bladder function if you didn't treat the bladder outlet obstructions. Then today why we have to talk about that, because we know that the prostate medications can improve your quality of life, improve the flow of the urine, but sometimes it didn't treat the bladder outlet obstructions. By the ongoing of the prostate enlargement, maybe in the future you can have the permanent damage of your bladder functions. Then today I would like to present about we call the early interventions, or some procedure that can help to relieve the bladder outlet obstructions. That procedure, it should be fast recovery, fewer risk, and proven its outcome is very good. Then when you take the prostate medication, we found that 82% of the case who take the medications is not satisfied with the medications. 66% of the case still have to wake up in the night for the urinations. And if we found that more than 75% when you see the doctor, the doctor not giving you the alternative options like a minimal invasive surgery instead of the medications. Then today I would like to present you about the minimal invasive one that can treat alternative to the medications. The first we have to start with the medication, but what is the problem of the medication first? Because the patients maybe have non-compliance with the medication because of the cost of the medications. The cost you have to take in the lifelong. Maybe if you take one medication, it's okay. But if you have to take 2-3 medications for control the urinations in the lifelong, the cost is quite high. The second one that is inconvenience because you have to take medication every day. Sometimes you forgot to take, sometimes you travel, you didn't bring with you. That is the make you have the trouble. Or even you have the lack effective. Maybe the medication is not work very well anymore. And the most important thing that the patient stop to continue the medication is the side effect. We found that only 29% of the case can continue medication at 1 year, and it's only 14% of the case continue medication at 4 years. This is a factor is considered by the patients who considering the BPH treatment. We found that if the treatment don't have to remove or cut the prostate tissue, 47% of the patients will be considered that treatment options. Or if any treatment is not effective about ejaculations, or even not effective about the erectile functions. The treatment can quick recovery and can return to normal activity. That should be the treatment options for the patient inside, from the patient inside. Then this is the revolution of the BPH surgery. In the past, we talk about the open simple prostatectomy. It means that we have to cut your tummy, right? And we have to go inside and remove the whole prostate. That operation is maybe, I think, 40 years ago. Now, we not have any urologist do that anymore because we don't have to do open on your tummy. Now, it's the era of the TURP and the laser treatment of the prostate. TURP is mean we do the transrectal endoscope to remove the prostate tissue. This is the gold standard for the BPH treatment. We use that for maybe 20 to 30 years, and it's still the standard treatment for the BPH. And now in the last decade, we have to talk about the minimal invasive surgery for the BPH. Now we have we call the Urolift and the Resume. The Resume is a water vapor treatment. This is, I would like to show you. If you take the medications, we know that the medication is that have the less effective, but it's less invasive. But the surgery is have the high effective, it's the best outcome, but also it have the highest invasive also. They have the complications after the surgery. The minimal invasive surgery is in the middle. It have the better than the medications and the less invasive than the surgery done. Then we do in the middle, treat the patients without any complications. Today I would like to talk about the Urolift. The Urolift is mean we have to put the small stent, small clip into the prostate. The small clip is mean that they have the two tab, and between the tab they have the PET suture to compress the prostate gland. And this is the delivery device to put the stent inside. This is how the Urolift system is worked. In the first picture is the enlarged prostate. The prostate is blocking in the water channel. And in the first step, we have to put the delivery device into the penis, go to the prostate area. The step 2, we have to put the small clip into the prosthetic capsule, and between the clip they have the suture to compress between the clip and make the water channel is open up. And this is the step 3. We have to put the stent, maybe 4 to 7 stent inside. The stent is can like hold the tissue of the prostate and open the water channel for you. And this is the video of the animations to show how to do the Urolift treatment. Do you have volume, please?
Urinary symptoms.
Thank you, sir.
Improve quality of life with minimal side effects. The Urolift system treatment is often performed in a clinic setting under local anesthesia. The Urolift system procedure begins by inserting a delivery device into the urethra. An inserted cystoscope provides the physician with visibility to the anatomy. On reaching the area of the urethra blocked by the enlarged prostate, the obstructive tissue is moved aside. A trigger press inserts a fine 19-gauge hollow needle through the prostate. The next trigger press deploys the implant, anchoring a small nitinol tab outside of the prostate while retracting the needle. Attached to the nitinol tab is a length of monofilament PET suture. The final trigger press completes the implant by placing a stainless steel urethral endpiece onto the suture. Depending on the prostate size and amount of blockage, several more implants may be placed in the same way. Typically, 4 to 6 implants are placed into the prostate. The physician will determine the number of implants needed to obtain an open channel. The outer capsule of the prostate is firm and provides a solid anchor. This allows the implants to lift and hold the enlarged prostate tissue out of the way so it no longer blocks the urethra. The implant size is customized to each individual patient and prostate lobe. As the suture is tensioned, it also shortens, compressing the prostate lobes to the side. This reduces pressure on the urethra and provides immediate, visible results, so urine can flow freely. It's a mechanical solution to a mechanical problem. The minimally invasive procedure requires no cutting, heating, or tissue removal. This procedure avoids erectile and ejaculatory dysfunction. It typically also means minimal downtime, mild to moderate side effects, and a quick return to normal activity. The Urolift system provides a clinically proven treatment for men who suffer from an enlarged prostate that can help men get off BPH medications and may help avoid major surgery.
This is the picture. It shows that on the right side of the screen, the prostate is blocking in the water channel. After we do the Urolift, the water channel is open up immediately, and your symptom is to be improved immediately after the Urolift treatment. And the Urolift system is have the many research in the worldwide, and they found the 5-year durability proven in the real world, and the clinical study is show that the symptom of the urination is improving within the 1 month after the Urolift, but with my practice, it's improving within the 1 week after the Urolift treatment. The Urolift system have no effect about the erectile dysfunction 0% and the ejaculatory dysfunction 0%. Compared with the medication, surgery, or any another invasive surgery, it still have some complication about that. And this is the guideline from the NICE guideline. Is a UK guideline. We found that the Urolift is the minimal invasive surgery. We can use consider alternative with the TURP or the home laser treatment of the prostate in the day case surgery or outpatient procedure for the patient who would like to preserve the sexual functions in the prostate size around 30 to 80 grams. And this is the guideline from the European Association of Urology. They can use the Urolift in the men who have the PPH, would like to preserve the sexual functions and have the prostate size less than 70 mils. And this is the guideline from the AUA. the AOA, we can use the Urolift instead of the medications to prevent the permanent damage of the bladder outlet obstructions. And in the United States, they use to over 100 grams. The post-treatment expectations, the symptom, it will be improving within the 2 weeks time, and it can have more improve up to 3 months. The most common side effect of this technique, maybe you have the dysuria, have the blood in the urine, or maybe the urgency. But most often it's just minor complications and don't need any intervention to treat them. Anyway, it should be like that for maybe a week time, or at least maybe 2 to 3 weeks time after the Urolift. The symptom will be improved immediately within the 2 weeks to 4 weeks time. The durability improvement is about 5 years. It means that 13% of the case need to do the second surgery after 5 years. It means 87% of the case maybe don't have to do anything. But I think they still have the more research in the future about the 10 years proven outcome. I think it should be launched in 1 or 2 years. And the indication for the Urolift treat the BPH who have the urinary symptoms, who over 50 years old, who is the good patient selection for the Urolift. We can use in the patients who want to increase or improve the symptom relief, or the patient who would like to stop the BPH medications, or in the patient who would like prefer the less invasive surgery than the prostate surgery, or even you would like to preserve your sexual functions, or maybe you're concerned about the prostate surgery like the TURP or the laser treatment, or if you the candidate for the surgery for the prostate like a TURP or laser, but you still worry about the complications, you still worry to preserve your sexual functions, or you would like to get the faster recovery, the Urolift may be the option for you. And in our hospital, we have the many solutions for the prostate treatment. We have the minimal invasive, the Urolift and the Resume, and we have the TURP is the standard one, and the laser treatment. In the different solution, it's the different outcome, and it's different the side effect. Anyway, our hospital, we would like to provide our expertise for every treatment of the BPH solutions. You are the patients. You can choose the one that you want. You can choose the one that make you have the less complications, or the one is suitable for you to do the operation, or even you would like to continue the medications. We can provide the treatment for you. And I would like to finish my talk today, and thank you very much for all of you for very good attention. If you have any questions, please can ask me. Thank you very much, sir.
You said that surgery, cutting the stomach and taking out the prostate, is a possibility.
It's possibility, but if you have the benign prostatic hyperplasia, that is the old-fashioned treatment we do maybe 30 or 40 years ago to remove the whole prostate.
But is it still possible?
Still possible, but we didn't do it right now because it still have a lot of the complications after the surgery.
Could you go back to that last slide? I didn't have the time to analyze all the different angles or different procedures.
Okay. Because it have many factors to talk, then because many options is have the different is have the variations. Maybe we can talk privately about the any options for the prostate treatment.
What controls the passage of urine once the prostate has been opened up with this procedure? What stops you urinating all the time once it's opened up?
Again, please, sorry.
Well, once you've had this procedure done and the prostate is opened up, what stops you urinating all the time?
No, because to control the urination, you have the sphincter. The sphincter is below the prostate area. That the sphincter is like valve off and on. You're gonna control by that sphincter.
The sphincter isn't part of the prostate then?
No, it's the different part of the prostate, sir.
Oh, okay, thank you. I didn't realize that.
Yes, sir. Then after we open the water channel for you, you not have the leakage because you controlled by the sphincter.
Dr. Niti, it says that prostate size for Urolift is up to, I think, up to 80. If you have a bigger size prostate, is it possible?
For the Urolift, I not recommend over 80 grams of the prostate because I think the outcome in the future is should not good. If you take a look the research data, you know that the Urolift is have the higher need the second surgery at 5 years. But I think it's because how to select the patients to do the Urolift. If you choose the good size for the Urolift, maybe you have the better outcome in the future, and maybe it can long lasting maybe more than 5 years. Then in the case we have over 80 grams, we have to talk about maybe it's not the suitable for you, or even you would like to do the Urolift, you have to accept the outcome. It should not last long as 5 years from the data,
Yeah, okay.
but we still can do.
Thank you.
I'm sorry, I'm very, very confused about it all. So for me, I find I'm urinating quite a lot. For instance, if I fill my water bottle or I fill my kettle, I feel I have to go for a pee. So do I need a surgery or do I need hypnosis to stop me?
Yes, sir. Because the urgency that you have, we have to find out first is because of the benign prostatic hyperplasia or because your bladder function is not good enough. Then I have to find out first which one is the main problem that you have. If the main problem is the prostate is blocking, maybe you can do the trial medications, or even you can do the small operations to relieve the pressure over there. The urgency, I think maybe around 70% of the case who do the operation, the urgency is getting better after that, 70% of the case. Yes, sir, please.
Yes, I have a question. If a patient elects to have prostate artery embolization and 6 months to a year later they're dissatisfied with the improvement, can they then proceed and have Urolift? And closely related, you indicated that the maximum size for Urolift is 70 to 80 centimeters. Do they ever do a prostate artery embolization to see if that will reduce the size so that if indeed it's not sufficient, you can then do a Urolift?
The prostatic artery embolization is mean that we do put some microparticles to the blood vessel feeding the prostate. That can make the prostate, it can shrink, but that one is not like a standard usage yet, but in some center they do a lot about the prostatic artery embolizations. Anyway, in your point, in my opinion, we have to recheck the size that you had is decreasing or not, or what is the problem that you have. But if you ask me, the Urolift can do after that or not, it can do after the PAE.
Thank you for your presentation. I travel over here for 4 months and then back to the U.S. Shortly before we came this year, I was concerned. I'd read your article, and so I made an appointment with a urologist in the United States. Only took me 3 weeks to get an appointment, and I he gave me a very thorough exam, and he said, no, you don't have a problem with your prostate. It's your bladder that's become inflexible and it won't hold as much as it used to, because my complaint was having to get up in the night 2 or 3 times to pee. So I had no flow problem. It was a volume problem. And so right now I'm on a medication that's supposed to help reduce or improve the flexibility of the bladder. So far, in 2 months, not much change, but he said it might take up to 6 months. So, but I think you covered that when you said you would have to evaluate. So, thank you.
Okay, that's why we have to evaluate that. You're right. We have to evaluate that the problem that they have is from the prostate enlargement or not, because we call the nocturia. Nocturia is you have to wake up many times in the night. It has many reasons. It's not only from the prostate. It's because maybe your sleep cycle is not good enough. You have to wake up in the middle of the night because of another reason. We have to take a look. Another thing that is can problem in the when you get older, we have the one hormone we call the desmopressin. This is the hormone in your body. It's for control we call the fluid in your body. Sometimes when you get older, this hormone is declining and make you have more the urination in the night. But on that case, you have to high volume of the urine in the night instead of the daytime. If you have the more urine volume more in the night compared with the daytime, maybe we have to think about you lacking of that hormone. If you're lacking of that hormone, we have some hormone replacement for that part, and I think it should reducing the urine volume in the night for you. That is more helpful.
Thank you, Dr. Niti. What is the difference between the Urolift 400 and Urolift 2?
It have the two model. The one model is have only in the United States. It's the new model, but we have the old model.
So it's the same procedure.
But it's the same. Just the model is not the same.
Hi, Doctor. Good introduction to something we don't want to know about. I saw this procedure through watching some medical information from the Queen Elizabeth Hospital in England, Birmingham, and these procedures were kicking about then, probably about 6 years ago. So it's nice to see you actually taking it up and offering it. Now, I've had a problem with waking up at night, probably 2 or 3 times, and going to the toilet, pain in the backside, because everybody's sleep is important as we get older. I've adjusted it. I stopped drinking tea and coffee after 6 o'clock. It's a diuretic and it causes problems. I also cut down my fluid intake up until 6 o'clock, drink what you want, after 6 not. Now I go to toilet, I go to bed about 11:30, 12 o'clock. I don't go to the toilet till 6:30 in the morning. So it's within your body, but you have to connect, all right? And it does work. Thank you.
That I talked to you before. The first step, we have to do the behavioral modifications. We have to drink less coffee, less tea, alcohol, or you have to drink less water after 6 p.m. That's a good idea. Thank you very much.
I appreciate your presentation. This is maybe a simple question, and that is, during the day, 12-hour period, what does a normal average person go to urinate? And then at night, what should be the normal at night as well?
The normal average, the urination per day is 8 times per day, and the normal is you have to wake up 1 time in the night, in the middle. Then if you wake up maybe 2 times in the night, it's not normal. And if you urinate every hour or 2 hours, I think it's high normal.
Okay. So I suffer from PTSD. So at night, I don't go into deep sleep. And I find myself getting up 3 or 4 times in the middle of the night to go urinate. Could that possibly be because I'm not going into deep sleep?
Yeah, that I talked to you before about the nocturia. It has many factors. It's not only from the prostate. Then if you have the problem, cannot deep sleep, you're gonna wake up. When you wake up, what you do? You go to the toilet and come back to sleep. That your behavioral. Then if you have the PTSD problem, you treat the PTSD. You can take the sleeping pills. If you can sleep more in the night, that the problem is because of PTSD.
Thank you, Dr. Niti. Nice presentation. Wish that had been available a little over 10 years ago when Dr. Pornchai did a TERP surgery on me. And I did notice on your slide that you said laser, but he chose not to do the laser because of PSA. He wanted to get tissue to have it checked. And yes, I did have prostate cancer, so I went to Bangkok, to the Bangkok Pattaya Hospital, which is part of your, and anyway, I had radiation treatment, which was effective. But as far as the TERP went, I still had some frequency in urination, but at night. But now I'm basically get up 1 time during the night.
That's very good. That's good enough. That's good enough.
Yes, my name is Stephen. Thank you, Doctor. I think we spoke a little bit before this meeting. It's off subject. Prostate BHP is a growing problem. I'm a cancer survivor of prostate cancer, and 15 years ago they used the Da Vinci robotic-assisted nerve sparing, blood vessel sparing to remove the prostate. But my consultation with the cancer people was at that time that the pelvic bone and the spinal bone are close to the prostate, and as it grows, it can pinch in the middle, your urethra, so it has no place to go on the outside, so the inside suffers. And I could see why larger prostates are going to run into obstructions on the outside diameter of the prostate. Getting back to after surgery, post-surgery for me was your bladder, your sphincter you talked about, and my doctor recommended instead of pills was physical therapy. He goes, your bladder's now weak because your prostate isn't a check valve. It has nothing to do with closing off or pinching off during normal operation, let's say. But what could I say was physical therapy, certain exercises. He did want to get into using a TIMS unit to stimulate the bladder muscles more, but we didn't go that far. I did well with the physical therapy. Post-operation, they did talk about hormone replacement therapy to shrink the prostate, but with the Reynolds numbers I had and the type of growth, that wasn't in the picture at that time. Thank you for your presentation on the growing problem.
Thank you very much, sir.
Like most of us, I think in the middle of the night you normally turn over and wake up. I think the normal sleep cycle is about 3.5 hours. You turn over another 3.5 hours. That should be normal. Sometimes I'll turn over, and just the process of turning over gives me this urge that I need to go to the bathroom. I say no to myself because the urge is just that temporary feeling because you've moved. So I say no to myself, and about 70 or 80% of the time, I just go back to sleep and I don't get up and go to the bathroom. So say no to yourself and see if that works for you.
Thank you very much. This is a very good idea. That's right. That's right. You can control by your brain. You can control by your brain.
I'd actually confirm that's the same in my case. If I tell myself to go back to sleep, I will do for another hour or so, and then get up to go to the toilet. My other question was, can the use of marijuana affect your nighttime urination? I found that if I take marijuana, I don't get up to go to the toilet during the night.
Okay, to be honest, I not have any experience to use the marijuana for the nocturia. Then I cannot tell you exactly on that part. But I think if you try that and you don't have to wake up in the night, I think it's okay. It's okay. But in my experience, I have no experience about that, sir.
Hi, doctor. Thank you very much for a very enlightening presentation. Since the time that my prostate became the size of a weather balloon, I started to do a lot of research. And what I have coming up on my computer right now is the fact that frequent ejaculation, preferably daily ejaculation, can be helpful to prostate health. Please tell me that's true.
Okay. They have the one research. They have the one research that about the ejaculations, how often that you get ejaculation that can help about the BPH. It can help about the prostate cancer. They told from the research they told 27 times per month. 27 times per month. That can helpful.
Yeah, I forgot to mention, I was calling in at a restaurant, and I was standing there looking over at this new massage parlour that had just opened, and I was reading the sign, and it turned around, and I thought, well, hang on a minute, that can't really be right, because it was supposed to say massage for enjoyment, but the wording came out as though it was massage of your anus. There's two words there, isn't there? You know what the words are. And I was absolutely amazed, actually. I wondered how many people had rushed in there. Funny sign. Thank you. It's shut down.
Sorry. Yeah, I just wanted to ask if it's inpatient or outpatient treatment for medical insurance.
Okay. For the medical insurance, it's up to your insurance policy. If your insurance policy is only inpatient, maybe I have to write the report to stay inpatient. But some of the insurance is asked back to me that you can do as the day surgery or not. I just told you that we can do off for the day surgery. They most of them approve for that procedure.
You have a wonderful presentation. I loved it all. But what I wanted to touch on is, what if those sutures or anchors come apart? Are you in pain? Does it try to urinate them out? You know, that is a possibility, I imagine.
You mean after the Urolift, right?
Yeah. After you anchor.
I told you that 90% of my case have the pain the first day after the Urolift, but in the second day it's much improving and is completely gone in 3 day times. Only 10% of my case still have the pain within 1 week. And after a week, everything is fine.
Okay, thank you.
What happens if the wires break?
No, it's not. It cannot break because it stay there. But when it stay there, it make we call the scar formations on the prostate area. Make the stent is get stronger after the operation, after 2 weeks time. Then after when we do the Urolift, I recommend my patients don't have the intensive exercise for 2 weeks. After 2 weeks, you can do everything that you want, but within the 2 weeks time, maybe the tissue would like to make the scar formation, to make the stent is get stronger, not break out and take it out by itself.
I have a friend who uses a tennis ball. He sits on a tennis ball between his anus and his scrotum, and he rocks backwards and forwards it as a means of massaging his prostate. Is there any evidence to say that that actually affects, it actually works?
I think it looks like the prostatic massage because they sit on the tennis ball, right? That the saddle is the prostate area. It looks like the prostatic massage we saw. I think some patients is helpful, but some is not. If you have the problem with the we call the chronic prostatitis, it means the inflammation in the prostate. You do the prostatic massage, it should getting better. But if the benign prostatic hyperplasia is blocking in the water channel, I think it should be the same.
So, doctor, there's been no cases of the sutures breaking?
No, we didn't have.
And how many surgeries have been done this procedure?
Now I do maybe more than 40 cases in 4 months.
40?
40.
You've done 40. But overall, this procedure, you're not the only one doing this procedure, I'm assuming.
Yeah, that's right. That's why I am only one to do this procedure, the Urolift. But anyway, all of the 40 cases, every case, they happy and no have any complications. But anyway, in 1 week after the surgery, maybe they have some complication like the blood in the urine, or maybe you have the urgency, or even you could not control very well. But after a week, every single cases, very good.
So just to be clear, you're the only surgeon that's ever done this procedure?
I can tell you that I am the doctor who do most the Urolift in Thailand right now.
Okay. So I guess
and I have the few doctor in the Bangkok to do the Urolift also.
So I could probably check on PubMed, but I don't know if I'm clear with the question. There's never been a suture that's been broken in all the procedures done throughout the world. In this particular procedure type.
I think we have some migrations of the stent, but that complication we found less than 1% of the case. But if we found in the operating room when I do that, then I can find the migration of the stent. But if we put in the good position already, it's still there. It stay there. It's not broken.
Okay, in the cases that you've done, but okay, I don't think I'm asking my question correctly. So you're not the only one who does this procedure. Out of all the procedures done, no one's had a suture break after 4 years?
Not have, sir. Not have,
Okay, thank you.
Thank you for your being here, Doctor. It is a day procedure normally, and what is the price range from bottom to top for sort of an estimate of the cost of this procedure?
The cost, they have our officer will let you know about that. But we do like a day surgery. It means that you come in the morning, right? Normally, I do the procedure in the afternoon times. After the operation, it takes time maybe around 30 minutes. You stay in the recovery room 2 hours and go home after that.
Okay.
Yeah.
And so the sort of price range is variable depending on what happens.
Yeah. The prostate have the variation is about the prostate size, is structure of the prostate. Then when we do that operations, we have to decide how many stents that we have to put for you. In every single case, it's not the same. Then I have to decide how many stents I have to put for you in the operating room.
All right, thank you.
Huge round of applause for a wonderful talk and Q&A from Dr. Niti.
Thank you very much. Thank you.
I think you can understand why so many patients speak so highly of him. Okay, well, yeah. So if you do have issues down there, you know who to call. Call Dr. Niti, and we have a small token of our appreciation, a new solution to the old prostate problem.
Thank you, sir. Thank you, sir.
Really great, thank you. Don't go. I think we still need you. Good lucky draw. So, as you know, it's always wonderful when BPH is here and we have these very attractive young ladies, you know, helping take all these tests and medical things. And you get a lucky door prize.
Okay.
So this is for a cancer screening, yes?
Yeah, prostate cancer screening, value 6,000 baht.
There you go, cool.
Okay. And you will be, after you get the screening, you have to see me after that, okay? Okay. Then can I get only one or five at the same time?
Let's mix them up, so because we always have trouble with...
I will get one by one, okay?
Yeah, one by one. You can pull them out quickly, but one by one.
Okay. The first is number 4.
Oh, I was number 5.
Number 4. Okay.
Number 4. Oh yeah, he was just before me.
Okay.
Here's another one.
Another one is number 18.
Number 18.
18.
Oh,
okay.
Musi. And
number 26. 26.
26. All right, good. We'll spread them around. Yeah, just stay here. Stay here. We'll give them to you in a second.
Number 15.
15.
15.
Oh. Okay. Is that it or one more?
And the last one. The last one. Number 5.
Oh my God, that's me. Thank God I didn't pull that one out myself. All right, cool.
Okay.
Oh my God, I'm going to find out that I've got cancer now. Yeah. All right, another round of applause for BPH and Dr. Niti. Oh, there you go.